Broadcast is now starting. All attendees are in listen-only mode.
Well, welcome everyone to the webinar this evening. A happy heart is a healthy heart. Should you have any technical difficulties during the broadcast, there is a number at the bottom of the screen to call Citrix support. The number is 1-800-263-6317. So welcome to the Cecilia Health webinar. We're glad you're here. This is an interactive program. Our format includes a short presentation followed by an interactive discussion. So to type in a question, use the question section of the webinar toolbar. At the end, you'll have a chance to ask questions, and so we do look forward to an interactive webinar. A disclaimer here. We know that the information you're about to hear may motivate you to make lifestyle changes, so please consult your physician before making any changes to your current routine. The Cecilia Health Certified Diabetes Educators will provide strategies to help you manage your diabetes. This online Q&A session is intended to give general advice. This information is not a substitute for personal medical advice and involves the professional opinion of the Cecilia Health Certified Diabetes Educators. So our webinar leader this evening is Andrea Castleberry. Andrea is a registered nurse and certified diabetes educator who has coached with Cecilia Health for several years. She received her Bachelor's of Science in Nursing from Baylor University and is preparing to begin her Doctor of Nursing practice at Baylor University. She's passionate about spending time educating with her patients so that they can live their lives to the fullest. In her spare time, Andrea enjoys spending time at the lake with her husband and 2 sons and 2 Australian shepherds. So thank you very much, Andrea, for being with us this evening.
Well, thank you, Katie, for the warm welcome. I'm glad to be here and to lead this webinar this evening, and I hope that you all find it useful and informative information. Just a little bit about myself. Before I became a certified diabetes educator, I actually worked in a heart hospital, so that was really dedicated to heart and vascular problems, and so I worked with a lot of cardiac patients and saw the relationship obviously between cardiac disease and diabetes, and that kind of led me to where I am now. So I'm very happy to be leading the webinar today and really look forward to an interactive webinar. So please, at the very end, utilize that question and answer time. I love to answer questions. So all right, well, getting started today, our discussion today will include what cardiovascular disease is. Cardiovascular disease is also known as CVD. So what are the risk factors? So why are people with diabetes at increased risk for cardiovascular disease? We'll also talk about the steps that you can take to prevent CVD. We'll go through some resources, and then again at the end we'll have the question, answer, and sharing time. So cardiovascular disease is also known as heart disease, and it's related to atherosclerosis. What that means is it's related to the plaque building up in artery walls. And when plaque builds up in the artery walls, it narrows the arteries. And narrowed arteries do a couple things. It makes it harder for blood to flow through the arteries. It can also increase the blood pressure, and it can also you can also have a clot form, and that that clot can stop blood flow, which could cause a heart attack or a stroke. So you see in the diagram there, you have a normal artery without the plaque, and then you have a diseased artery with plaque buildup and a blood clot forming there. So what is a heart attack? Or let's talk about first actually the warning signs of a heart attack. So the warning signs of a heart attack are discomfort in the center of the chest that lasts for a few minutes, or it can last for a long time. sometimes it can go away and come back, especially upon exertion. So if it goes away when you're resting, but as soon as you get up from the chair and walk around, you have that discomfort again, that is a warning sign of a heart attack. Also, discomfort in other areas of the body, such as the arm, the back, the neck, the jaw, or even the stomach, and nausea, a feeling of nausea. A feeling of shortness of breath, like an elephant is sitting on your chest. Breaking into a cold sweat, or what's also known as diaphoresis. If you're breaking into a cold sweat, but it's not hot and you don't know why, and you have these other symptoms as well. And then, as we mentioned, nausea or lightheadedness. And those are all symptoms of a heart attack. Um, and going back to a heart attack, as the picture shows here, a heart attack happens when there is a narrowing in the vessel, the artery in the heart. And when that narrowing happens, it can actually just cut off the blood flow at the point of the narrowing. And therefore blood can't get through, and blood carries oxygen, so oxygen can't get through to the rest of the heart muscle. And so that area of the heart muscle that goes without oxygen can become damaged, and that's what causes the pain when that's not getting blood flow, and the lack of oxygen causes damage. And so when I worked in the hospital, in the heart hospital, we always used to say time is muscle. So the faster you can get treatment when you're having these symptoms, the better. A heart attack can also happen if a smaller piece of plaque breaks off in the artery of the heart and travels down that vessel. And as the vessel gets smaller towards the bottom of the heart, if it doesn't break up and that clot blocks blood flow to the rest of the artery, that can happen as well and cause a heart attack. So the warning signs of a stroke are sudden numbness or weakness in the face, the arms, legs, and it tends to happen especially on one side of the body or the other. Sudden confusion, trouble speaking, or difficulty even understanding speech. A stroke can also cause sudden trouble seeing either in one or both eyes. It can cause sudden trouble walking, dizziness, a loss of balance, or a lack of coordination. A stroke could also cause a sudden or severe headache with no other known cause. So if you think someone may be having a stroke, the best thing to do is to act fast and follow the simple steps below. So look at their face, ask the person to smile. Does one side of the face droop? Ask the person to raise their arms outward and level with the ground. Does one arm drift downward when you ask them to do this? Also ask the person to speak, just to ask them to repeat a simple phrase. Is their speech slurred or strange? And then time. If you observe any of these signs, call 911 immediately. Again, time is of high importance when someone is having a stroke. So the sooner that they can get to a hospital, the better. So some other types of cardiovascular disease are heart failure, or you may have heard this called congestive heart failure, or CHF. This is when the heart isn't pumping blood as well as it should. And so because that blood that has been recently oxygenated provides oxygen to the rest of the body, when the heart's not pumping as well as it should, the body's need for blood and oxygen is not being met, and that can cause some other problems as well. There's also arrhythmias. An arrhythmia is an abnormal rhythm of the heart. And certain arrhythmias are benign, and other arrhythmias can affect how well the heart works. You may have heard some different arrhythmias like atrial fibrillation, atrial flutter. Those are different types of arrhythmias, and there's others out there as well. Heart valve problems. There's several different types of heart valve problems, such as sclerosis or stenosis. This is when the heart valves don't open or close properly. So those are some other types of cardiovascular disease besides a heart attack or a stroke. So the risk factors for cardiovascular disease, some of these are things that are within our control and others are things out of our control. So our age, our genetics, our gender, those are all things that we can't control. But we certainly can control our diet. We can control our lifestyle, we can control our smoking habits, and we can also have a great deal of control over our diabetes. So we're going to talk about all of these risk factors a little bit more. So cardiovascular disease and diabetes and how they're linked. At least 68% of people who are 65 years of age or older with diabetes die from some form of heart disease, and about 16% die of stroke. However, I want you to know that you don't have to be one of these numbers. Adults with diabetes are 4 times more likely to have heart disease or a stroke than adults who don't have diabetes. And the American Heart Association considers diabetes to be one of the 7 major controllable risk factors for cardiovascular disease. So why does having diabetes put you at higher risk for cardiovascular disease and stroke? So people who have diabetes are more likely to also have the following conditions that increase cardiovascular disease risk. So we're more likely to have high blood pressure, abnormal cholesterol levels, and high triglycerides, specifically a high LDL, which LDL is your unhealthy cholesterol. And we're more likely to have a low HDL, and HDL is the healthy cholesterol. So what you want is a lower LDL and a higher HDL. And what people with diabetes are more likely to have is the exact opposite of that, as well as a high triglyceride level. And people who have diabetes are also more likely to also have obesity. And then obesity is associated with insulin resistance. People with diabetes a lot of times also lack physical activity, and people with diabetes also have an increased risk for inflammation. So all of those things also increase the risk for cardiovascular disease. So let's talk about what we can do. We talked about we can't control our age, we can't control our genetics, but what can we do? So we can eat healthy, we can quit smoking, and we can exercise regularly. And doing those things will help to lower the blood pressure, will also help us lose weight. Exercising more will help in a lot of different ways. I heard a quote once, and I can't recall who it's from, but the quote was, that there's basically, the premise of the quote was, there's no anti-aging pill out there, but if you could put exercise into a capsule, you would have it. And that's exactly right. Exercise helps in so many different ways. It's going to help lower the blood pressure. It's going to help in your weight loss journey. And then it also helps to control blood sugars. So it's like a compounding factor. And again, by exercising more, it helps to manage diabetes. And then, of course, everything else that you can do to help manage diabetes as well. And then quitting smoking. So let's talk about blood pressure. High blood pressure actually doubles the risk of stroke if you leave it uncontrolled. So it is really important to monitor your blood pressure and to let your doctor know if it's high and to treat it appropriately if it's high. Meaning to follow your doctor's orders, to take any medication as prescribed. So American Heart Association recommends to maintain a blood pressure of less than 140/90. And some ways that you can do that is to limit your salt intake to 1,500 milligrams a day. That's about half a teaspoon, which is not very much at all. If you pay attention to nutrition labels, you'll notice that a lot of prepackaged foods are very high in sodium. And so when you're looking to limit your salt intake, not only doing away with, adding salt to your food when cooking, um, or sprinkling salt on your food at a restaurant, you really want to limit prepackaged foods and fast foods as well. So that's a great start. You can also eat 4 to 5 cups of fruits and vegetables a day. Those fruits and vegetables have a lot of fiber, which helps in numerous ways. And getting at least 30 minutes of moderate to vigorous exercise, at least 30 minutes a day, at least 5 days a week, or totaling about 150 minutes per week if you want to break it up differently. So that will help to control your blood pressure as well. Smoking, like we mentioned, smoking it causes constriction of your blood vessels, and that constriction raises your blood pressure. And so quitting smoking will help to lower your blood pressure. And then if needed and if prescribed, take your medication as prescribed to help lower your pressure. I often get the question, if I take my blood pressure medicine and my blood pressure is then normal, do I need to continue to take my blood pressure medicine? And before you ever stop taking any medication, you of course want to talk to your doctor, but a lot of times the reason that the blood pressure has become normal is because you are taking your medicine. And so therefore, if you were to stop taking medicine, it's possible that the blood pressure could then go up again as well. And so really want to take your medication as prescribed. If you are taking blood pressure medicine and maybe you're working on some other things and you stop smoking and you lose some weight and you're eating healthier and exercising, it's possible that you might need an adjustment in your blood pressure medicine. The last thing that we want is for your blood pressure to be too low and for you to get dizzy when you stand up and fall. So if you are taking blood pressure medicine and you're feeling dizzy or lightheaded, make sure you're monitoring your blood pressure and in communication with your physician about any changes that might be needed. So let's talk about obesity. Obesity and complications that are linked to obesity, such as high blood pressure and diabetes, raise the odds of having a stroke. So losing just as little as 10 pounds if you're overweight really does have a real significant impact on your stroke risk. So you may have heard of body mass index before, and that's just a calculation that's done with your current weight and your height. And it will give you a score. You can Google body mass index calculator and put in your numbers to get your BMI number. But the recommendation is to keep your BMI at 25 or less. And then also you can work with a registered dietitian to help you achieve your weight loss goals. If you're not sure of who would be a good dietitian to work with, you can ask your doctor for a referral. A lot of times that is something that is covered by insurance. You can also find a local dietitian to you by going to www.eatright.org. And then also, of course, increasing exercise and making exercise a part of every day will really help with obesity and help in weight loss. And I try to encourage both myself and my patients to make exercise something that's fun. It doesn't have to be going to the gym and locking yourself in the gym for several hours every day. I am definitely not the kind of person that likes to hang out in the gym. As Katie mentioned, my family and I love to go to the lake together, and so that is a lot of exercise. There's things that you can do outside if you like being outside, just walking. Um, and if you're not exercising at all right now and you're just nervous where to start, I just encourage you to, as long as your doctor says it's okay, just to start walking and see if you can go just a little bit further every day. And if you're not comfortable getting outside and walking, you can start that in your house. Um, I worked for a long time with pulmonary hypertension patients who would get very short of breath when they walked. However, walking was one of the best things for them. And so I used to tell my patients if they have a dining room or breakfast room table, just to turn the chairs at the table around so the seat is facing outward, and just start by walking around your table. And you know what? If you get tired, if you get short of breath, you're never too far from a chair. So no matter where you are, you can always get started at some point. So that's just what I want to encourage you to do today. So your blood sugar management really plays a huge role in the health of your blood vessels. So chronic high blood sugar will damage blood vessels over time. It kind of hardens the blood vessels and makes them not as elastic, and so therefore a clot is more likely to form. So of course we should monitor blood sugar as directed by your healthcare provider. And then use your diet and your exercise and your medicines as prescribed, or your insulin as prescribed, to keep your blood sugar within the recommended range um, as often as you can, or most of the time. Um, and then going back to blood sugar management, um, there are so many different things on the market today that can really help. I know that checking blood sugar can be difficult. Even though each check doesn't take a lot of time, just doing it repeatedly can be time consuming and can feel like it's pulling you away from your day-to-day activities. But there's things that are on the market right now that make checking blood sugar easier, like continuous glucose monitors. And so if checking blood sugar is something that your doctor wants you to do, but you feel like you're having a hard time doing it, I would encourage you to visit with your certified diabetes educator or your physician to talk about what things are out there that could help fit checking your blood sugar into your life. When when you get blood sugar readings, and the more blood sugar readings you have, you really see a correlation between how exercise affects your blood sugar and how different foods that you eat affect your blood sugar. So I think for a lot of people, the more information, the better, so that you can make informed decisions. Okay, so moving on to smoking. So we've already talked about smoking a little bit, but like we talked about, smoking will constrict the blood vessels, and it also accelerates clot formation. So it constricts the vessels, raises blood pressure, and accelerates clot formation. I would encourage you to incorporate your healthcare provider into the conversation on how to quit if you're interested in quitting. Um, and don't be afraid to use aids, such as nicotine pills or patches, counseling, or even prescription medicine. There's different prescription medicines out there that are designed to help you stop smoking. So talk to your doctor about what those look like, and if that is something that would work well for you. And then don't give up. Most people who smoke take several tries to stop smoking before they're successful. So just really see each attempt as one step closer to successfully quitting and beating the habit. Don't give up. So some different resources that are available for you. The American Heart Association has just wonderful information and resources on their website, which is www.heart.org. Also, the National Heart, Lung, and Blood Institute, which can be found at www.nhlbi.nih.gov. And the Centers for Disease Control and Prevention, which is www.cdc.gov/heart disease. The American Diabetes Association's website has wonderful resources, not only about diabetes, but also about nutrition and different methods of eating, such as the plate method, and they have a build your plate section of their website, which can really help to help you visualize what a healthy plate looks like. And that website is www.diabetes.org. And then nutrition.gov, www.nutrition.gov is also a great resource as well. So we have come to the question and answer time of our discussion today. Over on the right-hand side of your screen, you should have a toolbar, and use the question tab on your toolbar if you would like to ask a question, or if you'd like to type out a diabetes or heart health management tip that has worked well for you. I am going to mute myself for just a minute or two to allow time for questions to come in. And then I will take a few moments to answer questions and also provide some upcoming webinars that are going to be available here as well. Okay, great. So we already have the first question that's come in here. This first question says, what is the difference between a heart attack and cardiac arrest? That's a really good question, and a lot of times you hear those two words used interchangeably, but they aren't the same thing. So in your heart, you kind of you have two different systems at work. You have what I like to call the plumbing system and the electrical system. The plumbing system being the arteries of the heart that feed blood to the muscle of the heart. That's the plumbing system. And you have cardiologists that work on the plumbing system. So you might have heard of someone having a stent put in their heart. And a heart attack, like we talked about, happens when there is a blockage in the artery of the heart that either closes up slowly over time and blood flow is not able to get through, or sometimes there'll be plaque in the artery of the heart that will break off, like we talked about, and travel down to a more narrow part of the artery and prevent blood from flowing beyond that. So that's what different, what's called interventional cardiologists work on, and they can go in through a cardiac catheterization if necessary and open up the vessels in the heart. So those are cardiologists. Now, the other system of the heart is the electrical system, and they're actually different doctors that work on the electrical system of the heart. Those doctors, excuse me, are called electrophysiologists. And like I said, they work on the electrical system of the heart. Now, cardiac arrest can occur when there's a problem with the electrical system of the heart. We talked about some arrhythmias such as AFib and a flutter. There's a lot of different arrhythmias out there, like I mentioned, and most arrhythmias are not harmful, are either benign or they can be treated with medication, either to slow the heart down if needed, or to kind of prevent the heart from going into different rhythms. Now, there are some rhythms that can be more serious or even deadly. And so ventricular tachycardia is one of those rhythms that could be deadly if it's prolonged, because in ventricular tachycardia, the bottom of the heart um, beats really fast and out of rhythm with the top of the heart, and blood isn't able to flow properly, and therefore the body lacks blood flow, the brain lacks blood flow, and that can cause a cardiac arrest. And there's some other rhythms that can cause cardiac arrest as well. So cardiac arrest is an electrical issue or problem with the heart, while a heart attack has to do with blood flow to the heart. So really good question there. And we have another question as well. The next question is, how much does controlling blood glucose levels help to reduce heart events? This is a wonderful question. So I know that it is a ton of work to control blood sugars, but it really is worth it. Lowering your A1C to the recommended target, which the American Diabetes Association recommends, a target of A1C of 7%, which equates to an average blood glucose of about 154. And that helps to reduce heart-related events up to 17%, as well as all of the other things that it helps to reduce. So when you reduce your blood sugar, not only do you help to prevent cardiovascular disease, but you're also helping to reduce issues with the eyes related to diabetes, issues with your kidneys related to diabetes, and issues with neuropathy or the feeling in your hands and feet or your nerve endings with diabetes. So it's not just your heart that you're affecting by controlling your blood sugars, but it's everything else that diabetes affects. And then so just one more question that came in is, are there medicines that treat both heart disease and diabetes? Yes, absolutely. So there have been a few new medications that have come on the market recently that are approved to lower blood sugar, but have also been found to have some cardiovascular benefits as well. So I would encourage you, if that's something that you're interested in, to talk to your doctor about what those medications are and if one of those medications might be right for you. All right, well, I'm going to give a few more minutes for other questions here. If you have any additional questions, please feel free to type them into the questions tab. All right, that looks like it's about it for the questions today. Thank you all so much for an interactive webinar. I really enjoy answering questions. Just a few more things before we're over. So we have next month, we have the Diabetes 101 webinar, which is Mastering the Essentials of Diabetes. That's going to be on October 9th and also on October 16th. So if you're interested in that webinar, let your Cecilia Health Diabetes coach know, and they can help get you signed up for that. And then we'll also have, webinars in the future as well. So if you'd like to attend more events, just simply ask your coach. You can either ask them on the phone or reply to one of their emails, and we will be more than happy to share all of the available online events with you. If you haven't signed up for text messages yet, ask your coach about this. And also, if you're on Facebook and would like to connect with us on Facebook, we share a lot of really great tips and tricks. And you can just look up Cecilia Health Coaching on Facebook, and we would love to connect with you there. So thanks so much for joining us today. I really appreciate your attendance and your participation and for making it a wonderful and interactive webinar, and I hope that you found it helpful as well.